Just like to know that this is going to be recorded. So please mute your microphone at this time. We're going to be holding all questions and comments until after the presentation. So then for questions, we'll be stop recording so we can have a nice conversation. So it's a pleasure for me to be here and to welcome you all to our session today for the 2025 Global Collaborative Series Aligning Advanced Practice Nursing with Global Sustainable Development Goals. This monthly event is possible through the generous collaboration of our esteemed partners hosts. I'm Professor Jean-Marie Statuini. I'm Professor, Associate Dean for Global Affairs and Director of the Pan American Health Organization and the World Health Organization Collaborating Center at the University of Michigan School of Nursing. We also have Dr. April Kapoor, Professor and Associate Dean for Strategic Partnerships and Global Affairs at Vanderbilt University School of Nursing. We also have Dr. Asia Nopal, Director of Global Affairs and Planetary Health at Yale School of Nursing. And we also have Megan Allen, Doctor of Nursing Practice candidate at Yale School of Nursing. Thank you to all our partners for their dedication, contribution to this initiative. So each month, we'll take turns hosting this important series, and we encourage everyone to stay engaged by registering for future sessions. Now, it's my pleasure to introduce today's speakers, Dr. Beatriz Rosana Gonçalves de Oliveira Toso. She's going to be presenting today about APNs in Brazil, the challenges and opportunities for implementation. Let me tell you a little bit about Dr. Toso. She's an associate professor at Western Paraná State University in Cascavel, Paraná, Brazil. Dr. Toso held a postdoctoral fellowship from the Oswaldo Cruz Foundation at the National School of Public Health in London, England, in 2014, researching the advanced practice nursing. She currently leads the APN National Research Group for Brazilian Governmental Agency, CNPq. She has published more than 200 articles in scientific journals, more than 30 books, and more than 60 chapters. Her leadership also is amazing, but I want to highlight here that currently she's serving as a president of the Brazilian APN Society. So please join me in giving a warm welcome to Dr. Beatriz Toso as she share her expertise with us today. I just would like to one more detail. If you do need some translation, you can click on more and you're gonna see the language that you can translate this presentation today. Without further ado, Dr. Toso, you take the turn.
Thank you, Dr. Stasurini. Hello, everyone. As Dr. Stasurini mentioned, my name is Beatriz Toso. I am a professor at the Western Paraná State University in Brazil. I would like to start by thanking Dr. Stasurini and Dr. Kapoor for the invitation. It is my pleasure to be here with you today to talk about advanced practice nursing in Brazil, overcoming challenges and unlocking potential to achieve the Sustainable Development Goals through the unified healthcare system.
Excuse me, Dr. Kelso, if you want to share your presentation.
It's not sharing with you?
No.
Oh, sorry. I think I am doing that. Wait a minute,
That's
please.
okay.
I will start again.
That's okay.
Let's go then to share. This. Advise me if you can see this, please, Dr. Stachorini.
Yes, you have to put in the presentation mode.
Yes. Now it's okay.
Yes.
It appears to you. Yes.
Excellent, excellent. So, excellent. Thank you.
Yes. Okay, then. Let's go to introduce me a little more for you, only telling about the activities in advanced practice nursing. In 2022, I became a member of the American Association of Nurse Practitioners subgroup from the International Council of Nurses. In 2023, it was my pleasure to participate in the ambassador program from American Association of Nurse Practitioners. And in 2024, it was possible to participate in the exchange program for the development of nurse practitioners in Latin America in the Florida University. And you can see my photo, smile, beautiful, with Dr. Stachorini, who coordinated this program in Florida University. And in the same year, it was possible to participate in the 13th International Council of Nurses, Nurse Practitioner Advanced Practice Nurse Network Conference in Aberdeen, Scotland, UK. And in the same year, I became a member of the new Committee for Advanced Practice Nurse Studies of our Federal Council of Nurses here in Brazil. And you can see a photo with the group who stayed in the program of Dr. Stachorini in Florida in this year, 2024. And we stay very happy during this period there. And it is good to know that, fortunately, Dr. Stachorini are bringing this program to University of Michigan School of Nursing to continue this leadership in advanced practice nursing in Latin America. Then thank you, Dr. Stachorini, for this commitment with the development of the advanced practice nursing here in our region. Telling this to you, then we can really start with the presentation. And I decided to start to show you where I am come from to better understand about our country. As you can see in the Brazilian map, we are a very big country. We could be considered a continental country. And we are composed by 25 states, and these 25 states are the geographical and political division to the government of our country. And I am here in Brazil, south in the Paraná state, as you can see on right in the top of the slide. And then my city is in the west of our state, in the border with Argentina and Paraguay. And then a beautiful photo of my city. Of course, I am very proud of my region and of my city and of Brazil, of course. And to better understand why we need to develop advanced practice nurse in our country, I am bringing to you some data about Brazil. For example, as you can see, as a continental country, we have over 8 billion square kilometers, almost a continent, over 200 million inhabitants, very similar to the US, a demographic density with almost 22 inhabitants per square kilometer, more than 5,500 cities that are distributed in 5 regions, which we could consider extremely unequal in populations and resource distribution. There are around 8% of the Brazilian population living in the North region, as you can see in green here in the map. It is our biggest region in size, but the smallest in population. And of course, here we have Amazon forest. Then it is an area with difficult of access. We used to say here in Brazil that our roads in this region are the rivers, and then we delay sometimes 2 days, 3 days to access some communities who lived closer to the rivers. Then we have in the northeast, southeast, and south, as you can see in the map, our border region with the most famous beaches, when the most part of Brazilian population live. And in the Midwest, another almost 80%, a biggest territory, the West region and North, and the smaller population. Why it's important to know that? Because in these regions, we have difficulties to have health people to work, not only physicians, but inclusive nurses. We have an income concentration in the southeastern and southern regions, and the poorest social conditions prevailing in the northeast and north. We are considered around the world as a developing country. About the health conditions, some indicators can help us understand why we need APN to achieve the Sustainable Development Goals. We have a concentration of health professionals in big and more developed cities, and of course, in this border region in the east of the country. An insufficient number of nurses in the whole country. There is 143 nurses per 1,000 inhabitants. It is below the recommended number by the World Health Organization. We have a low number of physicians, 218 per 1,000 inhabitants. Our fertility rate nowadays is 177 children per woman, less the number that it's considered a great number to maintain the workforce in a country. A non-ideal child of mortality rate, 12.35 per million born alive children. We need to achieve the number with only 1 digit, as we have in the developed countries, but we not achieve this yet. Added to this, in big cities, the periphery is unattended. In rural areas, people have difficulty to access health services, and the indigenous, riverside, and slum communities are considered needy in terms of health and social care. With this slide, I think it's very clear why we need to develop advanced practice nursing in Brazil. We have a great number of people unassisted and with difficulty to achieve healthcare services, not only with physicians, but with nurses. And we need to offer this access and the resolutiveness of care for these people. Then it is fundamental to discuss this for our future. About the unique health system to answer the problems in our country, it's important to mention to you that in the 80s, a universal healthcare system called Unified Health System, this acronym for this is SUS, was created. This system followed the new constitution that restored democracy in our country after a long period under dictatorial government. Here, a pause for a clue. Have you seen the movie I'm Still Here? It talks about that period. If you not watched this film yet, I recommend to you to see inclusive because it is indicated for the Oscar in the beginning of the month. The SUS system is free, and universal healthcare in Brazil is a fundamental right for all citizens, as well as a duty of the nation. This is in our constitution. SUS system has three main principles. Universality, it is for all citizens, including foreigners in Brazilian territory. The second principle is equality, meaning that we should give people what they need so everyone has the same opportunities. And the third one, integrality, meaning that we view healthcare as both prevention to rehabilitation. And comprehensiveness considers the patient as a whole, not just their illnesses. The system is organized in three levels. These levels start from the health ministry to states' health secretariats to municipalities. How it is organized then? The Ministry of Health is the national manager of the SUS, which formulates, regulates, supervises, monitors, and evaluates policies and actions in conjunction with the National Health Council. Because another consequence of the new constitution in Brazil is the popular participation. Then people could give their opinion about the politics and what we need to improve in the system from the National Health Councils. These councils are reproduced in the states, then states health councils, and in the cities as city health councils. In the states, we have the second level of the system, and the responsibility of this manager is to carry out the administration to health on their respective state. For example, in the map, you have Paraná State, where I live, with 399 cities. Then the state has the responsibility to organize health services in these 399 cities as a whole. And for the cities, the responsibility is mainly primary health care. The access to people through the system is starting in the cities through the primary health care services. Then, how it operates? Primary health care in Brazil operates under the model of care called family health strategy. This family health strategy is composed by teams, and each team is with one physician, one nurse, and 1 to 4 auxiliary nurses, one community health agent. This personality is a little unknown, I believe, for you in the US. But this professional has the responsibility to be the link with the community and the team. Then this professional goes to the houses to see how people are going in their health and bring information to the team, take decisions to prevent diseases, for example. And each team of that is responsible for around 4 people. It is like a small city, for example, as when we compare to the responsibility for people for each one, and sometimes we have more teams in a same unit when we have, for example, 5,000 people in a neighborhood. And the primary healthcare units are the gateway to the healthcare network. People can go through the network only accessing by the primary healthcare unit or by the emergency services when we have, of course, an emergency, and then the ambulance services are responsible to get these people inside the network. Then PHC offers comprehensive, affordable, community-based care for around 8% of individuals' health needs over a lifetime. And this includes a spectrum of services ranging from health promotion, for example, better nutrition advice and prevention as vaccination and family planification, to acute and infectious disease management, chronic disease control, palliative care, and rehabilitation. The services offered in PHC includes physician and nursing consultations, procedure as inhalations, injections, dressings, vaccines, obtention of laboratory samples, dental treatment, because dental treatment is covered by SUS in Brazil. It's not a part of the system. Referrals to specialties, provision of basic medication, consider in a next basic next of medicine that we have this support. I need a minute to put my computer on the energy. Sorry about that, Dr. Jani. I need to save the presentation because I can't interrupt just now. Only 1 minute, please. I forgot to do this before. Pardon because of that.
That's not a problem at all. Perhaps our colleagues can take the time and put in the chat where you are from. We would love to know where our colleagues are connecting. Just put in the chat for us. Okay, I think Dr. Tolso is back. I'll turn to her. But just that was about you, where you're from. Go ahead, Dr.
Okay.
Tolso.
Then, following about services offered by the primary healthcare in Brazil, we specifically for nurses now, because it is our topic today, what our general nurses used to do now, not what we expect for advanced practice nurses, but the regular tasks for a nurse includes carry out direct nursing care in urgencies and clinical emergencies, indicating the continuity of care provided, carry out nursing consultations, request additional tests, prescribe or transcribe medications according to protocols established in the Ministry of Health programs and legal provisions of the profession. An example of a program like that, for example, is for the treatment of tuberculosis. In Brazil, we have guidelines for that. Then nurses could prescribe the treatment and follow these patients with this disease. Not only that, but only as an example. But it is not considered advanced practice nurse because it is under a guideline for the Ministry of Health. Plan, manage, coordinate, execute, and evaluate the family health unit, taking into account the real health needs of the population served. It is interesting to comment because we have people for different countries here, and in Brazil, in the most part of primary healthcare services, nurses are the manager of these services, not only manager for the nursing tasks and the nursing team, but the manager of the units. It is very usual in Brazil. To carry out comprehensive care actions for children, women, adolescents, adults, and the elderly, to combine clinical performance with the practice of collective health, and to supervise and execute actions to train community health agents, nursing assistants by focus on performing their duties. Then I think it was a small and fast explanation and how our system operates. Of course, we can talk a long time about that, but only to understand the system and why we need advanced practice nurse. Then I will offer you an explanation about the educational process for nurses in Brazil. We have 4 possibilities to be educated in the nursing career, since the technical one not covered in this presentation, to undergraduation, receiving the bachelor title, and going further to master and doctorate programs, which will be discussed next. The undergraduate programs have obeyed a national curriculum guideline, which determines 4,000 hours in 4 or 5 years with equal theoretical and practical approaches, divided in hospital and public health settings. In the most part of the curriculums is 50-50, 50% for the primary health care or the public health services and 50% for hospital training. Most of nursing schools in Brazil are private, almost 90%. And to practice, nurses in Brazil are under a general law since the 80s, which designs the professional categories and responsibilities for each one in nursing area. Nowadays, most of the nursing professionals are technicians, as you can see in my pyramid in the slide. We have around 60% of technicians, 24% nurses, and 17% nursing auxiliaries. To better understand, nursing auxiliary is equivalent to LPN in the US, and the technicians are equivalent to RN without the BSN. Going further in the education, in the postgraduate, two more kinds of education are possible. Specialties, equivalent to graduate or professional certificate in the US, and residences. Residence, I think, is similar for our countries. Specialties require a minimum of 360 teaching hours. The programs can be offered by any teaching institution. There is no regulatory mark for this, as we have for residences, for example, and for bachelor and master and postgraduate and doctorate courses. And of course, it follows a regulatory ordinance, but any kind of areas could offer a specialty, as mental health, neonatal and pediatric, public health, among others. The residences may be uni or multi-professional health courses whose main characteristic is in-service training. The number of credits in 60 are 60 per week for 2 years, totalizing over 5,000 teaching hours. Based on that, this modality is considered the gold pattern in health education in Brazil, inclusive for nursing area. The other two possibilities are master and doctorate programs. In Brazil, there are two types. The academic one, we can consider this similar to the PhD in the US, and the professional one that we could consider similar to the DNP in the US. As for PhD or DNP, by now we have 79 programs in the country. This page that I am showing to you is for our agents called CAPES. It is the governmental agency when we need to submit a project, when we decided as a educational institution to offer a program of master and doctorate. As an institution, we can't offer without this approval. Different from the US here, we don't have accreditation after we start a program. We need to get this accreditation from the project and then we can start. And by now, we have only 79 programs in the country, as you can see here. Comparing to the USA, that I get this number from 24, you have now around 426 DNP programs. Then we are 5 times smaller than you, showing that we should increase the offer of programs in Brazil to improve the education for nurses in our country. Now, after to explain you about our health system and about the nursing education, it's time to start to talk about advances and challenges for implementation of APN in Brazil. And I will try to cover you 4 topics: research, regulation, practice, and education. Then, starting with research, we get our first publication here in Brazil in 2013. It was a result of a technical visit for some Brazilian nurses here in the US, and then they published the result of this in this first paper about the topic. Now, in 2023, 10 years later, we get 43 publications showing that the interest in the issue increases and the number of publications. And this map is from the study of Dantas et al. In 2024. They made a bibliometric study from the master and thesis approved by our government agent called CAPES. Then they analyzing the production from thesis and dissertation, and the number was 25, covering the period from 2018 to 23. The authors found 25 results, predominantly in the southeast area, because we have a concentration of post-graduation programs in this region. And then because of this, we have more results in this region too. And these programs covered in the most professional master programs and focusing on primary healthcare. Because of these studies, we are discussing starting with advanced practice nurses in our primary healthcare, because we have now a great number of studies showing that this is the area when we need the most. And the important message here is the number of research results being published is increasing, what shows the interest of Brazilian nurses on the topic. What this research addresses as advances and challenges? As advances, our training potential, because we are in Brazil increasing the number of master and doctorate programs and residence programs. We have primary healthcare public policies very well determined, showing that we have space for advanced practice nurses in this area. We have a law of professional practice that I will show you ahead that is very supportive for that. And the advanced practice nursing competences already carried out. We are discussing this from the experience from other countries. By the other hand, as challenges, we have absence of a specific legislation by now, a professional corporativism very present in our country with a division between health professionals with the tasks, lack of role clarity as we have around the world, absence of specific training education for APN, and nurses resistance. We are discussing around these years with a lot of conference, and we can see this nursing resistance mainly because the majority of nurses don't know what APN is, and because it is unknown, then it is rejected in the majority for the professionals. About the regulation, what we have by now, this law for nursing practices that is very supportive for advanced practice nurses, because our law from the Act says that nursing consultation is privately for nurses and to carry out greater technical complex that requires scientific-based knowledge and ability to take important decisions, and approve that nurses could act as prescribers from medication established and public health programs and in routines approved by health institution. Then it is the first step that we have. But what is missing? By now, we have a work group from the Health Ministry, and this work group was instituted in 2023, focused on the discussion of nursing practice in Brazil. This group are covering valorization of nursing, specialized training, regulation of professional practice, and labor relations, for example. But it's not enough. Who regulates the practice in Brazil is the Federal Council of Nurses. And this Federal Council of Nurses has a commission renovated in 2024 discussing a regulation for APN, and probably now in 2024 we can get some guidance for start with this in Brazil. It is our expectation. What our Federal Council of Nurses make as initiatives for APN implementation in Brazil? I bring you a very fast timeline here. And it starts in 2015 with the participation of the council in an international meeting called by Pan American Health Organization. In 2016, as consequence of this meeting, the COFEN, our Federal Council of Nurses, created the first APN committee. In 2018, this committee take part in a national study from understand the practice of general nurses in Brazil in primary health care, to see if this practice could be considered as advanced practice nurses. In 2022, a cycle of online lecturers with key APN professionals from different countries were developed in the partnership with this Federal Council of Nurses and the Pan American Health Organization. In 2023, the COFEN system renewed the APN committee with a new ordinance about that, and published a technical note about the some concepts about APN to clarify concepts, the nomination function, and it is accessible for any professional as the glossary with terms of APN, as you can see in green here in the slide, and it is available for any nurse in the web page of the Federal Council of Nurses. And my last topic about the state of APN in Brazil, it is education, as I promised to you on the first slide, and what we are thinking about education for APN in Brazil. As I commented with you before, we can open a program to educate nurses as an educational institution. It's not possible. We need to send projects for our government organ called CAPES to approve these projects. Then in 2022, Brazilian universities presented to CAPES 5 proposals for APN master education programs in different realities in areas. 2 in women's health, 2 in the care of chronic conditions, and 1 in the association format among 6 universities focused on primary care. Unfortunately, any one of these proposals was accepted by our system, and by now we have no programs for education of APNs in Brazil. But how we are thinking to offer these programs? We have 2 possibilities. The residency courses, then we could start with a residency in family health nurse, for example, and an extra year from develop APN. We have professional master programs, and we could start offering this for APN either, and we can associate it both, and then we have a third possibility to educate these professionals. And now, to start to go to the end of my presentation, finally, I will talk to you about the APN implementation in Brazil and the helping to achieve the Sustainable Development Goals. Then, to talk about that, we have this 17 goals shown in the slide, and I would like to highlight 5 goals for our discussion and start to finalize my presentation. I will start with the goal 3, good health and well-being. Why I believe that APN could help us to achieve this goal? APNs could improve the access to essential health services like primary care attention in the Latin America region, especially focusing on following patients with chronic conditions. improving the vaccination in all ages, and safeguarding vulnerable population groups and individuals residing in places with high disease prevalence, very common in our region. The goal for quality education is directly linked to nursing practice and impacts in therapeutic adherence and health literacy, for example. In this goal, APN has the potential to counsel patients and families to better care while they are training the team to get better results to reduce social determinant impacts on health. The goal 5, gender equality, assumes great importance for us nurses, mainly in our region, due to the majority of women in our career. Despite this is not the point, we could help empowering women to get the right to access sexual and reproductive health care, for example, offering these services in PhD sets from APN and offering counseling for families to avoid violence against gender and promote peace. We can act in the goal 6 to clean water and sanitation, since the PHC keeps government accountable, invests in water research and development, educates communities to water sanitation, and promotes the inclusion of women, youth, and Islam, indigenous communities in water resources governance discussions. And the least but not less important, the goal 10, reduce the inequalities, could be under our umbrella, because the APN should invest in health actions, health education, social protection, and promote local policies to deal with the social determinants of health, as decent jobs, especially for young people, migrants, and refugees, and other vulnerable communities. I strongly believe that advanced practice nurses has the potential to change health conditions in Americas. This is my cause, to bring the role to Brazil and other countries in Latin America. Together, we can make the difference to change the world, or at least to change the health conditions to people living in the world. Then some references that I use in my presentation for you. I think this presentation will be available for you after. And I would finish my presentation showing you this beautiful photo with me and my colleagues from the Ambassador Program in the US in New Orleans with Dr. Capot. And then another photo with Dr. Stasiorini in the College of Nursing in Florida with my colleagues from the program next year to learn a little more about APN. Obrigada. Thank you for listening me today. Now I am available to talk a little more with you.